Evidence provided by Healthabitat has helped highlight the links between housing quality and health outcomes in remote communities. What are the key lessons for housing design? What is Healthabitat? Healthabitat is a non-profit organisation dedicated to finding solutions to health problems prevalent in Aboriginal communities. It was founded in 1985 by 3 directors when working with the Pitjantjatjara people in South Australia. They were brought together by Yami Lester, director of the Nganampa Health Council. He tasked them with the problem Yuankara Painku Kainjaku in the Pitjantjatjara language, or Stop Getting People Sick in English, referred to with the acronym UPK. After visiting communities, they quickly found that just improving treatment was not having a significant effect on public health. Instead, creating a healthy living environment was fundamental to solving prevalent health issues, looking at solving the cause rather than solely treating the symptoms. The importance of considering a solution which intrinsically links both health and housing is ingrained within this company by its 3 directors, Paul Pholeros, an architect, Paul Torzillo, a thoracic surgeon, and Stephen Rayo, a public and environmental health officer. This 2-pronged strategy has allowed for more cohesive solutions than any other more focused government or charity projects conducted in the past. Healthabitat is data-driven and led by research-based processes at its core. Its work is oriented around 9 healthy living practices. These practices were established in the UPK Environmental Health Review, written by the directors and informed by research statistics gathered from various Aboriginal communities.
What are the key lessons for housing design? First, washing facilities for adults, but more importantly, for children under 5 years old, as it significantly reduces the rate for 4 common childhood illnesses: diarrhea and respiratory diseases, pneumonia, skin infection, and trachoma. Second, washing for bedding and clothes are required to reduce the chances of skin infection and diarrhea disease. Thirdly, human waste disposal. A functional toilet system is crucial in order to maintain a healthy living. Fourth, nutrition. A balanced diet is one of the fundamental needs for a healthy human being. Coming in fifth, a healthy living environment will require sufficient personal space designed for each individual resident within the community. Sixth, separation of dogs and children, especially at drinking water sources, to avoid illnesses caused by bacteria and parasite carried by the most common house pet. The 7th healthy living practice is dust control in living environments to avoid respiratory and eye-related diseases. 8th, temperature control. Due to the rapid change of desert climate for Aboriginal communities, considering insulation and natural ventilation in housing design crafts a healthy living space. And the last one, reduce trauma. As statistics demonstrate, Aboriginal children tend to be at a higher risk of accidents in community settings, which often leads to hospitalization and, in certain cases, permanent disability.
How has Healthabitat been implementing these principles? I'll let Paul Pholeros answer this in his own words.
We start on day 1 of every project. We've learnt we don't make promises, we don't do reports. We arrive in the morning with tools, tons of equipment, trades, and we train up a local team on the first day to start work. By the evening of the first day, a few houses in that community are better than when we started in the morning. That work continues for 6 to 12 months until all the houses are improved, and we've spent our budget of $7,500 total per house. That's our average budget. At the end of 6 months to a year, we test every house again. It's very easy to spend money. It's very difficult to improve the function of all those parts of a house. And for a whole house, the 9 healthy living practices, we test, check and fix 250 items in every house.
We can take the case study of the Pitjantjatjara people in the far northwest of South Australia, where the cause of illnesses has been the Nganampa Health Council's primary approach in the treating of illness. And through changing habits and the implementation of the 9 principles of healthy living, illness has been reduced. At the time of the UPK report, only about half of the 2,000-strong community had access to housing, and the residents had less than a 50% chance of being able to get basic services such as running water, plumbing, and electricity. But by 1992, 81 to 100% of houses had access to these services. Due to the implementation of the Healthabitat principles, at least 2 of the identified issues, skin and eye infections, were both reduced. The principles have been implemented at various communities around the country through the Housing for Health process, but many of the core issues still remain, and it remains difficult to gauge improvements in health, which would imply that the method of implementation is not community-based enough.
What could be done better? 3 obvious flaws can be identified in the work of Healthabitat. Firstly, over the last 30 years, the world has changed significantly, and this is just as relevant within Aboriginal communities. Therefore, these statistics that Healthabitat is driven by are outdated and also contested by some within the communities themselves. Secondly, despite the fact that 70% of all project staff are Indigenous people, the organisation does not demonstrate Aboriginal involvement in the decision-making at the top levels. There still appears to be a top-down approach to helping these communities. To improve this, Healthabitat may need to explore more effective ways of communication with local populations, as opposed to simply hiring local community labourers. Thirdly, Healthabitat has pointed out one of the biggest factors of bad community housing is lack of maintenance, yet based on reports they have produced, it is not being addressed. More communication with the residents is needed for effective maintenance to be reported and executed.
So what are the key lessons for us? In regards to maintenance and upkeep, house repair attributes to a large amount of money spent on housing. It is therefore important that designs are built well to begin with, and with durability in mind. However, 73% of houses require repair due to lack of routine maintenance, whilst only 19% is due to poor initial construction and 8% damaged by tenants. Therefore, most important is involving these local communities with projects, so they can have pride in construction and will have the tools and knowledge to continue this necessary routine maintenance themselves. The importance of fixing items within a home may appear insignificant in the larger picture, but have a huge effect on the safety and health of a household. The healthier the individual homes, the healthier the communities will be. We should try to avoid discussing community needs in opposition to personal improvements. Both are equally valid problems and should not be considered as opposing choices. Positive change can be slow and incremental, working on a personal level. In the past, politicians and charities have wanted to achieve instant solutions for political expediency. This short-term framework denies the long-term interests of the Aboriginal communities, which should always be key. We will leave you with this quote by Nelson Mandela. Poverty is not natural, it is man-made and can be overcome and eradicated by the actions of human beings.